Namaste and welcome. So today we are going to discuss a topic a lot of people have asked me in many different ways. Now, how much is my genetic predisposition, my family history, how much is my lifestyle, my environment, how much am I responsible, how much is somebody else responsible? So this is a very important question. But before I go to that, let me address two more things. Number one, there's a beautiful study came out actually just this week in Journal of American College of Cardiology. It's a study spanning 20 years of data collection of almost 9 million people from Korea. And what they found out is that all the people that had a heart attack or stroke or heart failure had one of the four factors. They either had high blood pressure or high cholesterol or diabetes or they were smoker. So they identified these four as major risk factors. So to understand study properly, please understand this. It is true that 99% people that had heart attack had one or more of these four factors. It does not mean that everybody had these one or four factors had the heart attack. So that is one thing you really need to understand. There's so many people that come to me and say, such and such had a cholesterol of 300, never had a heart attack, whereas such and such had a cholesterol of 150 and had a heart attack. So there are exceptions on both sides. Okay, there'll be exceptions on both sides. That does not make the rule. Just because a person with a cholesterol of 300 escaped heart attack does not mean that everybody with a cholesterol of 300 will escape heart attack. On the other hand, if somebody at 150 ended up having heart attack, it does not mean that lowering cholesterol is not going to help. So this is very important. You need to understand this. There are variations that happen because there are other risk factors also that come in. Your diet, your activity, your stress, your truncal obesity, alcohol, sedentary lifestyle, poor sleep, disharmonious relations, all this we talk about in our DASH program. The second thing I want to discuss with you is that we have outlined a full program for you. So you should really be following all 6 things that we say in that, and I'll share that with you today. So let's go to the crux of the program today. Is it choice or is it chance? Okay. Genetics predispose you to lifestyle disorders. And the choice that you make determines whether it is going to manifest or not. So a lot of people have this confusion. Is it written in my genes or is it in my hands? So let's see how it pans out. But before I go, I told you, all of you who have joined today, make sure that you do all 6 things that we have set up for you. Go to our website and know your risk. What is your risk of having heart attack based on your lifestyle? Is it low, intermediate, high, very high? Simple. There are 17 or 18 questions that you answer and you get your score. Those that have done it before should do it again because after having done it, the program for a month, 2 months, or 6 months, you see how much difference it has made. Have you changed certain things? And if you have, then have you lowered your risk? So that's a very important thing. Second is there are certain labs that we recommend, and I'll discuss with you those. Make sure that you test those bloods. And again, as you're doing the program, 3 months, 6 months, you repeat those labs and see if you're making a difference. So you need to know if you're making a difference. And if you're not making a difference, just listening to the lectures is not going to give you any benefit. Same way, download the app, do the 14 modules, both instructions and videos, and do them again and again. Each time you revise it, you learn something new. And this today's program that you're in, you should come into it twice a week, Tuesday, Thursday, 7 p.m. we do it. And I hope you're also doing daily live yoga. Okay. And join also our Integrated Heart Center YouTube channel. So go to the channel, subscribe to that. So for all these edit information that we do will be there for you at any time you want to reference something. So by doing all these 6 things properly, right, you're going to make a progress. So remember that. All right. So what is choice? Choice is doing something proactively, which is for your benefit, choosing that. In every decision that you've made in life, it doesn't matter what it is about. If you really look back deeply and analyze, at every juncture, you had a choice of doing 3 things. I should do it. I should not do it. I should do it differently. Okay. So doing, not doing, and doing differently, that is a choice. And you exercise that on everything. Now, where does that choice come from? It does not come from your mind. It does not come from likes and dislikes. It comes deeply from your intellect, your determinative, discriminative faculty that tells you what is right for you and what is wrong for you. If the choice is made through likes and dislikes, there's a likelihood you're making wrong choices. If a choice is made through intellect after proper understanding of the subject and knowledge, knowing what is beneficial, knowing what is harmful, and then making a choice, that is an informed choice, a correct choice. So remember, don't make choice just because I like to do it. The chance comes in 3 different ways. One is your genetic makeup. Whatever is coded in your genes predisposes you. Now, as we'll discuss further on, it is not just because you have a genetic predisposition that you will get certain problem. It is not straightforward. It's not a straight line. Your environment, where you live. Now, this includes your family environment, social environment, geographic environment, all of these. On some of these, we have a choice, but on most of these, we don't have a choice. Growing up early in life, we don't have a choice. Later on, when we're adults, we have a choice. We can move, right? So that is a component of chance. Your socioeconomic status, right? That is also a chance. For example, a 5-year-old in a very poor laborer's family, now he is not responsible for his economic situation. He just happens to be born in a family which is socio-economically deprived. So that's just a chance. That is not his choice. So the choices are, for example, in DASH, we say the diet that you choose, activity, stress, sleep, social relations, spirituality, harmony, harmful exposures, tobacco, alcohol, drugs, pollution, all these things. There's some choices there. Okay. So how do they interact? It is not either or. It is not, okay, you have a genetic predisposition and therefore you'll get a problem, or you have a poor lifestyle and therefore you'll have a problem. No, it is a predisposition. It gives you more chance of or more likelihood of getting this. Okay. So the genetic predisposition will predispose you to certain conditions like blood pressure or diabetes. And then lifestyle has an influence. Lifestyle, a poor lifestyle will compound the effect of that genetic predisposition, and you're more likely to get the problem. A good lifestyle can negate the genetic predisposition and make sure that you don't get that problem. So let me give you a personal example. Okay. My father, my brother, and my mother, as I've said before, all 3 of them had heart attacks. So I have a genetic predisposition to get a heart attack. But I can change that genetic predisposition by changing my lifestyle. If I follow everything that I say in my program, the chance is that I can negate the influence of that. Now, negating influence does not mean that I'm going to live forever and never die. No, that doesn't happen to anybody. This is our everyday experience. Everybody has a finite lifespan. What it means is instead of getting a heart attack in 40, 50, or 60, a person who, despite his genetic predisposition, improves his lifestyle can predispose, change it to 70, 80, or 90 years of age. So you can add 20, 30, 40 more years of healthy life without getting a heart attack. And there's a dynamic interaction between these two, your lifestyle and the genetic predisposition. Okay. So let's say somebody has a genetic predisposition like myself to get a heart attack. And I change my lifestyle and I do it for 1 year and I quit, right? So that 1 year is only going to give me so much benefit. So it has to be a constant change that you make and it has to be continuous. So the longer you do it, the longer is the effect. The problem comes in all the studies that we do in this lifestyle disorders, especially heart disease, is it is not that somebody has blood pressure, diabetes, and cholesterol, and tomorrow he'll get a heart attack. No, it predisposes you, and that may be 5, 10, 15 years away. And by changing lifestyle, you make it 30, 40, 50 years away. So you understand that? There's a dynamic interplay between the two, but there is also a temporal interplay between the two. The longer you change the lifestyle and follow, greater the chance you mitigate the effect of your genetic predisposition. So, what are the genetically inherited problems that we get in this? Obviously, smoking is not genetically inherited. Although there's a predisposition of smoking in families where your father or brother, everybody smokes, chances are you may end up becoming a smoker too. But blood pressure, there is some impact of genetics in that. Diabetes, there's an impact of genetics in that. Cholesterol, there's an impact of genetics in that. Okay. So, for example, I told you my example of my father, mother, brother getting heart attack. My father, brother, and mother, they all had high blood pressure, but I escaped. So the genetic predisposition is not 100%. Now, I don't know whether I escaped or I prevented it with my lifestyle. My father and mother both had diabetes, but my brother and I don't have diabetes. So we either escaped or maybe we prevented it with a lifestyle, right? So there is an impact of genes, but there is also an impact of environment, and they're kind of interconnected and complex. So you can minimize one by maximizing the other and vice versa. Somebody who has a strong genetic predisposition for diabetes, blood pressure, high cholesterol, and heart attack will have to have that much more effort made in lifestyle to mitigate the effect of that. So it's not as simple. It is not 2 plus 2 makes 4. And that is why some people don't understand this properly. And they say, well, my father did not have a heart attack. My mother did not have a heart attack. My brother did not have a heart attack. My sister did not have a heart attack. Why did I get a heart attack? Because in your lifestyle, there are certain things that you're doing that strongly predisposed you to this. So, how lifestyle predisposition causes a heart attack, you simply go to our website, and if you look at that risk score that we have, you will know your risk. It is highly, highly unlikely that somebody had all the labs, that 15 labs that we do, all in the range that we talk about, and also had a very low risk of heart attack based upon the lifestyle score that we have on our website, ended up getting a heart attack. I'm not saying that no one will, but probably 1 in a million. Whereas somebody who comes up with high likelihood of heart attack on a risk score, all the labs 15 that we recommend, they're all abnormal. he has blood pressure, family history, diabetes, cholesterol, smoking, drinking, sedentary lifestyle, poor diet, stressful living, highly likely that he'll get a heart attack. I'm not saying tomorrow, but his 10-year chance of getting the heart attack is almost 40 or 50%. It is still not 100%. It is still not 100%, but it is there. So you understand how predisposition, likelihood, percentage chance impact it. So if you have family history of diabetes and family history of blood pressure and family history of cholesterol and family history of heart attack, you have to be extra cautious. So that is the interpretation from this. Now, you also have to understand that if you have a family history, but right now you do not have high cholesterol, blood pressure, diabetes, your genes can be activated by the environment. So if you end up creating an environment, either personal, lifestyle, stress, socioeconomic, pollution, or where you live, so all these things impact that, then you can make that genetic predisposition manifest in you. So let us say everybody in your family had blood pressure, but you live a very healthy life, you follow the DASH principles, you've done your labs, you've done your risk score, you're following the program, you're eating right, sleeping right, waking up right, no stress in life, no disharmony, not smoking, not drinking, everything is good, no pollution, you're walking daily. In this lifetime, you may not get diabetes, you may not get blood pressure, you may not get heart attack. So that is what you need to know. Now, unfortunately, pollution is becoming a very major risk factor in India. Now, remember I told you four things: blood pressure, diabetes, cholesterol, and smoking. 99% people that get heart attack have one or more of these four. Pollution, unfortunately, has become the modern day smoking. Same way you have these chemicals that you inhale when you smoke that go in your bloodstream and predispose you to a heart attack through various metabolic interactions as well as oxidative stress, right? Same way, these chemicals that you inhale because of pollution, they also go and cause those complex metabolic interactions and oxidative stress and inflammation in the body and predispose you to a heart attack. So unfortunately, if you're living in a city with very high pollution and you're living mostly or your profession is outdoors most of the time, then you are having same effect on your life as of smoking, although you're not smoking, but you're smoking that smoke that is in the environment. So that is the effect of pollution, which is independent. Your socioeconomic condition, right? If you live in an area where there's no access to healthcare, or because of educational deficit, you don't do periodic blood tests, checking, preventive care, right? It predisposes you to that. You may not have access to resources because of your financial problems. There's some people who are economically deprived. They cannot afford to go to doctor. They cannot afford to have blood test. So these are the environmental factors which are beyond an individual's control, but they also contribute to disease. So genetics contributes to disease, environment contributes to disease, and lifestyle. But in these lifestyle disorders that we're discussing, if you look at it, 80% is lifestyle, 10% is environment, and 10% is genetic. Even environment and genetic, which is 10%, is also, as I explained to you earlier, through epigenetic mechanisms, can be impacted by lifestyle. So lifestyle can modify your environment. Lifestyle can modify your genetic predisposition. Let us say you're a very poor person living in urban environment, taxi driving, inhaling all this smoke. You may be making a little bit more than what you would make in your village. And then you decide, no, I don't want to take this pollution, and you move to your village. Your living expense will go way down. You may be earning less there, but you've mitigated all the environmental effect there by inhaling better air quality. So there is genetic susceptibility, but it is not straightforward. See, there are certain diseases, let's say Huntington's chorea. You have seen some people have that disease where they have abnormal body movements. So single gene change can manifest that. It is dominant. You know that if one got it, everybody in the family will get it. Most of the inheritance of blood pressure, diabetes, and cholesterol doesn't depend on one gene. We call it polygenetic. Many genes are required in a many different ways. So it is not a straightforward genetic transmission. So I already discussed the effect of environment on the genes, and I discussed the effect of diet on the genes. Again, I'm going to emphasize that there is a variable disease development, and that variability comes of the fact that so many patients that come to me and I tell them, please follow the dash. And they say, हमारी diet तो ठीक है. No, I do good diet. And I ask them, what is your cholesterol? हमारा cholesterol is normal. But if you really look at the way we look at cholesterol, they have highly elevated lipoprotein little a. Their ApoB, ApoA ratio is high. They have a lot of total cholesterol, maybe 190, but the remnant cholesterol is 60 or 70, very high, right? So they've not looked at all the factors. And if you look at all the factors, you'll find out that you have to optimize all those. So that is why so many people come and say, I don't believe you about the cholesterol because my cholesterol or my uncle's cholesterol was normal and he had a heart attack. There's no such thing as normal, and there's no such thing as abnormal. You have to really look at what level your risk of heart disease go high and at what level it goes low. But it is never going to go 100% and it is never going to go zero. You have to understand this. This is not and or situation. If somebody has a cholesterol of 170, but he does not smoke, but he drinks, does not exercise, has blood pressure, has diabetes, is obese, is sedentary, is stressful. Now, somebody else has a cholesterol of 220, but he has no diabetes, no blood pressure, he's stress-free, exercises, he's not obese, he eats good diet, everything is fine in his life. Now, look at the chances. One has 170 cholesterol, one has 220. The 220 did not get a heart attack, but 170 got a heart attack. So there is a variable penetrance and development of disease due to various factors acting independently in their own way. So if somebody has blood pressure, diabetes, cholesterol, smoking, drinking, obese, stressed out, living in a polluted environment, not exercising, very disharmonious relations in life, very poor sleep, not doing any yoga, meditation, pranayama, no exercise, eating highly oily, fried diet every day, not eating fruits and vegetables. There is still a 1 to 2% chance, 3% chance that this guy may not get any problem. Whereas there may be who may be doing everything right, still has a 1 to 2% chance that he may end up getting heart attack. So it's not absolute, but it's relative. So what you're doing with all this program is reducing your relative risk. So what do? You know your risk, right? It's simple. You went to a website, you calculated, and you know that you come in the high risk group. Now, when you come in the high risk group, now you know that no amount of prayer is going to prevent heart attack. You have to be proactive. What do? You change your lifestyle. You join the Integrated Heart Center program, you learn the DASH principles, all the preventive services that we recommend. And then you start doing them. No, it's not enough to do them. I've done all 14 modules, sir. I know what to do now. But gradually you'll find out that if you're not doing this on a regular basis, you fall off the cliff. You stop doing it. And that is why you have to continue to follow us. Not for 1 month, not for 2 months, but continue and get repeated exposures. So, what is the plan? Plan is you have to take the ownership. Don't hide behind genetics. Don't hide behind family history. Take personal responsibility. Tell yourself, yes, there may be 5 to 10% unfortunate risk I inherited from my family, but 80% is in my hand. I need to educate myself for my well-being. And I can modify the effect of my genetic predisposition. I can modify my epigenetic. Remember, so many times in the past, I've told you this beautiful study from Harvard where they had people that meditated for 6 weeks. Some were good meditators, some novice, and they did 20 minutes of breath focus meditation twice a day for 6 weeks. And they saw almost 250 genes were upregulated or downregulated. So that is the profound effect of meditation on genetic. If you have a genetic predisposition, you can modify that predisposition by changing your epigenetics by just doing meditation. And that's why I keep saying that of all the medicines that I recommend for lifestyle disorder, the best medicine is meditation. The next is activity. Next is diet, right? Now, obviously, there are researches coming. There is a genetic defect they find in certain enzyme or certain places, and they can chemically modify that by medications and even reduce the effect of gene expression. So there are researches coming now that you can also change the epigenetics, just as I said with meditation, also with chemicals, injectable or medications. Now, lifestyle I already discussed, right? Okay, so what are the other advances coming? We are actually identifying more and more by genetic testing your predisposition by analyzing your DNA to certain disorders. So I'm sure that in the years to come, we may have genetic testing which may tell us what percentage chance we have of getting blood pressure or diabetes or heart attack or stroke or cancer. Just like we tell now based on lifestyle scoring and all these multiple factors, there may be also a genetic risk score that will come up. There's a lot of research going on in this direction. So what they can then do is they can select out those genetic problems that you have and find a solution for that. Okay, you modified this and this and this genes with lifestyle, you modified this and this and this genes with this medicine and this genes with this drug, injectable, and create a personalized treatment plan by changing the choices and changing the chance or the genetic. And that day is not far off. The science now is progressing at a much, much faster pace. And with the AI that has come, doing all these permutations, combinations, calculations, and creating these database and analyzing them is becoming that much more easy. Okay? So there will be individualized, personalized plan for each of you in future. But until such time, you basically have what I'm telling you is what is available. So timely diagnosis. Timely diagnosis means that if you are getting regular checkups, you find out blood pressure, diabetes, cholesterol, right? Before the heart attack, not after the heart attack. Unfortunately, most of the time it happens is you end up in a hospital with a heart attack, and then you find out about your blood pressure, diabetes, and cholesterol. It should be the other way around. So when you find that out, you should be proactive. If there's medicine that's needed, you take that. Lifestyle, which is the cornerstone of that. You do that. Then you reduce your chances of getting a heart attack. So remember these 10 pillars. All of you, please make sure that you download this. Print this, download from the website, print it down, put on your fridge with a magnet, look at it daily. How much of these you're following, how much you're not following. And then this is how we do it. We give you a plan, guideline directed. We tell you how to modify your risk factors. We tell you how to change your nutrition, stress, activity, sleep. We give you yoga, meditation, pranayama. So all this we have outlined for you. All this is ready-made for you to follow. And then you check your labs periodically, as I told you. And this is the ideal where we want you to go. Now, you may not be there today, okay? And you may not even get there in a lifetime. But the more you get closer to them, more you are reducing your risk of getting a heart attack. So once again, and I'll tell Dr. Shashank to post this in the live. Please make sure that you have done all 6. You know your risk, and you periodically go to our website once every 2-3 months and reassess your risk and see if it is improving. You know your labs, and you periodically every 3 to 6 months check your recommended labs and see if the parameters are moving in the right direction. You download the app and you complete 14 modules. So on the top of the modules come instructions, daily instructions, day 1, day 2, day 3, day 4. It doesn't have to be every day you do it. You can do it every other day or every 3 days. But important thing is do all 14 modules. So when you look at those module instructions, there's a corresponding video also at the bottom. Make sure you open the module, study that, and then read the video, because the video I've explained how to do this for those people that cannot just read and understand, then you understand through video. So through these two, you get all the instructions that you need for changing your lifestyle in those 10 dash parameters of DASH. Now, those that have done it, my request to them is do again. Because each time you will do it, you'll pick up something different. You'll also find out that when you did it initially, you emphasized on certain things and the others you left out. And later on, you found out that actually what you left out was more important, and then you did it again. So practice and repeat the practice. Join the life that you're joining today. Make sure that you all sign up for our daily morning yoga. Our yoga meditation program that we have, it is a cardiac yoga meditation program. It is not just a substitute for physical activity. No, it is not just physical yoga. So that's why we say just because you're doing yoga does not mean you're doing full physical activity. You still have to do your physical activity, walking 7,500 steps a day, right? Or doing gym, or doing exercise, or doing sports, all that in addition to that. Most of the benefits that you get from our yoga is really your mind transformation, your stress management, improving your sleep, creating harmony in your life, bringing peace in your life. And that also affects your lifestyle, that motivates you to follow the lifestyle mode. We have all the instructions I told you on those 14 modules, but periodically I also upload YouTube's information based on if something new comes out or if I get inspired to say something new, all that we put on a YouTube channel. So if you subscribe to the channel, anything new that we post on the YouTube will come to you for additional knowledge. And sometimes you can go back, there are references to, for example, you want to know more about oil, for example. So we did on YouTube on oil, you reference that. Some people want to say, okay, I want to know more about stress. Then you reference the one on stress. So all these YouTubes are there. So subscribe to our channel and share it with your friends. All these things that I wrote there, they are for you and for your family and for your friends. Feel free to share with everybody. Okay? The more people benefit, the more we benefit. If you pass this on to your friends and family, or in your Facebook, or in your social media channels, or in your social groups, you are creating for yourself a very good karma, right? and that is going to help you. So when you make an effort to improve the health of others, your health improves. When you make an effort to make other people happy, you become unhappy. So I hope that you also go ahead and help other people to get healthy. So thank you very much. See you next time.